Actually, hepatitis C is also a kind of virus disease, but the important is currently it chronically infected people around 180 million worldwide, and in Southeast Asia itself is almost around 100 million of the patients who chronically infected with hepatitis C live in Asia Pacific regions. The problem is the disease after infection, majority of the patients become chronic infections, and this can lead to chronic hepatitis, which actually have chronic injury to the liver and eventually result in chronic liver disease, including liver cirrhosis, decompensated cirrhosis, and most importantly, hepatocellular carcinoma or liver cancer. Because most of chronic hepatitis C patients, they still asymptomatic, had no symptom. They would have symptom when they have a quite advanced liver disease. For example, patient having advanced fibrosis or liver cirrhosis. So therefore, if we let until the patient come to see us, it always come to the quite advanced state of the chronic liver disease. Therefore, educate the patients, let them aware about it. This is so important, and that's why some countries they're talking about screening in order to detect the patient at the earlier state of disease. You ask me how can we diagnose hepatitis C? Usually we still use the blood test. We look at we have two kinds of blood tests. The first one is the anti-HCV antibody that just check the antibody against hepatitis C. It's not really specific. It depends on the prevalence of the disease among that population. If you use this screening test, anti-HCV, in those who have the low risk, no risk of acquiring hepatitis C, the positive predictive value to predict the patient actually have hepatitis C is just around 60%. In contrast, if you look at the patient who have high risk, like those who have intravenous drug using in the past or receiving blood transfusion prior screening era of hepatitis C, you will see that the positive predictive value to predict that patient would have hepatitis C is over 90%. So, put in a simple way that screening test in high-risk population is almost equivalent to diagnostic test. When we have patient positive with anti-HCV, we have to confirm. Usually, currently, we use the HCV RNA, and that can confirm the viremia. That means the hepatitis C virus in the patient body, and you're also able to measure the amount of hepatitis C we call viral load. And last but not the least, we also determine the genotype, because clearly genotype of hepatitis C is still the one factor associated with the treatment strategy and treatment response.